Epilepsy is a neurological disorder that affects millions of people worldwide. It is characterized by recurrent, unprovoked seizures that can vary in intensity and manifestation. Understanding epilepsy, recognizing its warning signs, and knowing how to manage it effectively are crucial for those living with the condition and their caregivers. Understanding epilepsy. Epilepsy is a disorder of the central nervous system where brain activity becomes abnormal, leading to seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. The causes of epilepsy can be diverse, including genetic factors, head trauma, brain conditions such as tumors or strokes, infectious diseases such as meningitis or encephalitis, prenatal injuries, and developmental disorders. Despite these known causes, in many cases, the cause of epilepsy remains unknown. Epilepsy warning signs. Recognizing the warning signs of epilepsy can be life-saving. These signs can vary depending on the type of seizure and the individual. Common warning signs include, aura, a feeling or sensation that occurs before a seizure. This can include strange feelings, unusual smells, or visual disturbances. Sensory changes, tingling sensations, numbness, or a feeling of dizziness. Changes in vision or hearing, seeing flashing lights or hearing strange sounds. Emotional changes, sudden feelings of fear, anxiety, or déjà vu. Physical symptoms, uncontrolled jerking movements of the arms and legs, loss of consciousness, or staring spells. Managing epilepsy. Effective management of epilepsy involves a combination of medication, lifestyle changes, and sometimes surgical intervention. Anti-epileptic drugs (AEDs) are the primary treatment for controlling seizures. These medications help stabilize electrical activity in the brain. For those whose seizures are not adequately controlled by medication, other treatments such as vagus nerve stimulation, ketogenic diet, or surgery may be considered. Epilepsy and lifestyle. Living with epilepsy requires attention to daily habits and lifestyle choices. Key tips for managing epilepsy include, regular medication, taking prescribed medication consistently and as directed by a healthcare professional. Healthy diet, eating a balanced diet to maintain overall health and well-being. Adequate sleep, ensuring sufficient rest, as lack of sleep can trigger seizures. Stress management, practicing stress reduction techniques such as yoga, meditation, and deep breathing exercises. Regular exercise, engaging in physical activity to improve physical and mental health. Epilepsy triggers. Identifying and avoiding triggers can significantly reduce the frequency of seizures. Common triggers include, lack of sleep, insufficient rest can lower the seizure threshold. Stress, high levels of stress or sudden changes in routine. Alcohol and drugs, excessive consumption can interfere with medication and lower seizure control. Flashing lights, bright or flashing lights, which can trigger seizures in photosensitive individuals. Hormonal changes, menstrual cycles or hormonal fluctuations can affect seizure activity. Epilepsy in children. Children with epilepsy face unique challenges, requiring special care and attention. It is crucial to work closely with pediatric neurologists to manage their condition effectively. This includes regular medical check-ups, ensuring adherence to medication, and creating a supportive environment at home and school. Educating teachers and peers about epilepsy can help in fostering a safe and understanding environment for the child. Epilepsy first aid. Knowing what to do during a seizure can make a significant difference. Key steps include, stay calm, keep yourself calm to help the person experiencing the seizure. Time the seizure, note the duration of the seizure, seek medical help if it lasts longer than 5 minutes. Protect from injury, move objects away that could cause injury and gently guide the person to the floor. Do not restrain, avoid holding the person down or trying to stop their movements. Recovery position: once the seizure ends, help the person into the recovery position lying on their side to keep the airway clear. Stay with them, remain with the person until they are fully alert and aware. Living with epilepsy. Hearing personal stories from individuals living with epilepsy can be incredibly supportive and inspiring. These narratives often highlight the resilience, strength, and hope that people with epilepsy and their families embody. Sharing experiences helps build a community of understanding and solidarity, offering comfort and practical advice to others on similar journeys. Epilepsy awareness. Raising awareness about epilepsy is crucial for reducing stigma and promoting understanding. Educational campaigns, community events, and social media can play significant roles in spreading awareness. Highlighting facts about epilepsy, dispelling myths, and sharing resources can help foster a more inclusive and supportive society for individuals with epilepsy. Technological innovations. Advancements in technology are making a significant impact on epilepsy management. Wearable devices that monitor brain activity, smartwatches with seizure detection capabilities, and mobile apps for medication tracking and seizure logging are just a few examples. These innovations offer greater independence and improved quality of life for individuals with epilepsy. Mental health and epilepsy. The impact of epilepsy on mental health is profound. Anxiety, depression, and mood disorders are common among individuals with epilepsy. Addressing mental health is a critical component of comprehensive epilepsy care. Access to counseling, support groups, and mental health professionals can greatly enhance the overall well-being of those affected. Epilepsy and media. Epilepsy warnings in media content are essential for protecting viewers with photosensitive epilepsy. Filmmakers, game developers, and content creators must be mindful of the potential triggers in their work. Including clear warnings and providing alternative viewing options can prevent seizures and ensure a safer viewing experience. Research and future directions. Ongoing research in epilepsy is leading to promising new treatments and therapies. Studies on genetic factors, brain imaging technologies, and novel medications are paving the way for more effective and personalized epilepsy care. Staying informed about the latest research developments can empower individuals and their caregivers. Support networks. Building a support network is invaluable for individuals with epilepsy and their families. Support groups, both online and in person, offer a sense of community and shared experiences. Organizations dedicated to epilepsy advocacy provide resources, educational materials, and connections to healthcare professionals. Epilepsy in the workplace. Understanding workplace rights and accommodations for individuals with epilepsy is essential. Legal protections ensure that employees with epilepsy receive the necessary support and adjustments to perform their jobs effectively. Educating employers and colleagues about epilepsy can create a more inclusive and supportive work environment. Through comprehensive understanding, effective management, and compassionate support, individuals with epilepsy can lead fulfilling lives. Recognizing the importance of epilepsy awareness and fostering a supportive community are key steps toward improving the quality of life for those affected by this condition.